Siri is going to talk to us about some of the varieties and some of the issues surrounding litigation, the right to health. And the first question to ask is for her to address what might be called a puzzle, which we've already commented on, which is how far is the increasing amount of litigation, and it's so interesting that this is so widespread across the world. This isn't just regional, this is very widespread. Is this a dangerous pandemic? Is this going to distort, or is it something which is actually going to make change in a way that might be desirable?
That was the question that we wondered about when we were doing this cross-national national research that sort of is the basis of this book that you can look at if you want to. And I think that in some ways it goes to many of the questions that we've been discussing today. Because at the one hand, you have the question of how to best address the right to health in the system as such, which is driving, although sometimes in imperfect ways, the work on priority setting in health and reform of health systems. And then on the other hand, you have the concern for the individual and how to protect the rights of the individual in the system and how to hold the system accountable for the right to health. So we were looking at how this played out in different countries. And this is very much, and what we found was that this is definitely a matter of sort of complex systems interaction. Because on the one hand, you have the legal system that works in different ways in different countries. You have the health system that works in different ways in different countries. And then you also have power structures and mental models that are different in different systems. So what we found was a lot more differences than we actually thought, but we also were able to see some patterns and maybe some structures to go with the discussion earlier today. And we also found that judges were addressing this in really different ways in different systems. So maybe I should start there by saying a little bit about that. Because what we found, and I think we already know a little bit about that, is that in the Latin American countries that we looked at, which had the largest number of cases. I mean, Colombia had almost 150,000 cases in 2008 on the right to health. Costa Rica had many cases, Brazil had many cases. There, the vast majority of cases were individuals going to court to claim an individual right to treatment. And what the courts did in most of these cases was to take each individual case, sort of looking at each individual case and then deciding, in most cases favorably to the claimant, that the right to health with dignity gives rise to the right to a right to health, which demands that this patient get the treatment. So that was sort of very simply the basic logic of most of these cases. And what we found when we went to do interviews was, of course, that many people who were, I think this was reflected in the controversies in the Costa Rican table yesterday, when they were discussing the rating, that the people who were from the system side, they said that, but this is distorting our work when we try to make an essential medicines list, because a lot of this is on expensive drugs. So this is distorting our system. So what we tried to do was, or what we did was that we took the cases, for instance, in Costa Rica, we took the cases for 2008, we looked at the material, we looked at the drugs that were being litigated, the effectiveness of the drug, the cost effectiveness of the drug, the seriousness of the disease related to the economic level of the society. And what we found was that in most cases, the drugs that were being litigated and granted by the court were very expensive drugs for very serious diseases and with marginal gain. So it was marginal gain at high cost for the system. And it was very often drugs that we would not necessarily get in the Norwegian healthcare system. So that was one interesting finding that we found. And that pattern was quite consistent across the countries. But when we went back in time and looked at some of the early cases of the Costa Rican court, we found, for instance, that they would grant the right to HIV treatment early, and that was very cost effective. So that's a case of a relatively stigmatized, marginalized group who did not get to treatment and who were granted by the court. So, and you also find other cases. So it's not consistent, but in Costa Rica over time, it is more expensive drugs. And the reason for that is maybe that the court is very effective, because when the court grants the drugs, it goes on to the medicine list. So after some years, or some cases, it goes on to the medicine list. That does not happen in Colombia, for instance. That's why you have so many cases. So then you continue to litigate for the same cases over time. So that was one important finding. But then we also saw that it has other functions, the litigation, because it also exposes malfunctioning in the system. It also says that this system is not working correctly. You're not complying with your own rules. It's not sort of, there might be corruption, but at least malmanagement, inefficiencies. So the court cases are also a way of pointing to problems, diagnosing problems in the system, and maybe urging the system to shape up. And also, in some cases, challenging, I think, the mental models of what is possible to do and not. It's a way to say, okay, you say it's not possible, you show me that it's not possible. So it's also so it's interesting. It's not a very simple picture. It works on different sides, but it is a way. But there are problems. There are clear problems in terms of how it drives it.
So just to sum up a couple of major points there, that we can see ways in which litigation can distort provision, but in other areas it can actually mobilize change that is necessary. And I think it's already been implicit in what you said, but one of the concerns a lot of people have with judicial activism in whatever frame is its relationship with democracy. How far this is truly arriving at something that would be the will of the people expressed through their representatives, and how far not. Could you talk a little bit more about that?
Yes, I think when the South African Constitutional Court was established after the transition in '94, it was established in '95, and then their first case on the right to health, and which was the first socioeconomic case, came in '97, and the judges were really, really worried about this. They were really concerned about how they should meaningfully adjudicate these rights without sort of taking over the political domain, which also, of course, had to do with having a very powerful party in power. But also they were concerned about not becoming a queue jumping place. Sort of, they didn't want to be a gatekeeper deciding who gets and who doesn't get. Because in South Africa, it was clear that the demand was huge and the capacity is not necessarily good enough. So they were really struggling with how to do this. So what they did in the first case, which was a really hard case, because it was a dialysis case, it was a man called Subramuni who he was suffering from renal failure and he needed dialysis. And he could no longer afford to pay, so he went to the court. And the court said, it's clear that there are more patients needing renal failure that the system can sustain. But we will not just sit back and say we can't do anything. What we will do is that we will make sure, we will ask from the system, make them come and give evidence that they have a good and reasonable system in place with criteria for prioritizing patients, and that this system was followed, and that they actually use the resources that they have to a maximum. That we can ask of the system. So what they did was they didn't grant each patient, but they said that we can still challenge the system to make sure that it works efficiently. So that's one way. So that's sort of within the limits of the system. But then in other cases, that was not so easy. There was another very famous case where most of you will know that President Mbeki had a very sort of denialist, or had a very strong stance on not providing HIV/AIDS medication. So there was a very clear political blockage on the issue in South Africa. So, one of the social movements working on the issue, the Treatment Action Campaign, brought a case to court, asking the government, the court asked to tell the government to supply pregnant mothers who are HIV positive with medication that would prevent their children from getting infected. And so what happened in that case was that the government was told that its policies were not reasonable and that they would have to have a plan for the whole country to roll it out. In that case, there was already, while the litigation was going on, a policy was being developed. So it was easy for the court because they could just say a rollout, basically. In other cases, the court has done it in a different way. Like in Colombia, the Constitutional Court, as many of you will know, handed down a decision saying, you basically have to reform your health system. They didn't say it's an unconstitutional state of affair, but almost. I mean, they said that this is in violation of rights, and you have to make a plan to reform it. When you reform it, you have to use a human rights-based approach. That's basically what they said. You have to make sure that the panther is there, that you include different groups in the definition of the health policy, and so on. And then they set timelines and kept sort of jurisdiction of the process and had reports back over time. So that is a way, and there are different cases of that. And that's a way where the judges say, the rights put demands on the system, and you have to make sure that you're within the scope of the rights, but we will not tell you how to do it, because there is too much disagreement among reasonable people on how this is best done. So we will let you work that out, but you have to come back and convince us that this is the best way of doing it within the framework that the rights provide.
I thought this was very interesting. There was a phrase in Siri's handout which I hadn't come across before myself, many of you would have done, which is dialogical judgment. And I think that's a really important idea, as Siri has just described it, how judges task the policymakers with coming back with a coherent policy that accepts the rules that have already been established and is involving human rights and stakeholders to the full. That is.
Yeah, I think that is also a way. I think sometimes we think about judges having the last word, but there's usually never a last word. I mean, it's also always a dialogue, and here it's an explicit dialogue. It's like judges have a very powerful word, and also people in court. I mean, I didn't say that, but the courts in many cases, particularly where the threshold is really low, like in Colombia and Costa Rica, where people can come very easily to court without having to pay, without the lawyer, then it also becomes a way for people to voice, people's voice, people to engage in discussion. Maybe not the best way, but still a way to engage in discussion on how the systems should be and how they should be treated. So that's also actually an interesting mechanism. But I think that also this idea that the judges have something interesting to say to the policymakers. They have an interesting, they can express a very important interest that is in the Constitution and that comes from the Constitution and from human rights, and make sure that that's taken into account.
Thank you. And perhaps, and this is a final question from me and then open to the floor, is that what you've been describing is justice working on various levels with regard to policy making. You've also got to think about the population level and the individual level. Could you perhaps give some concluding comments on how these measure up in these different areas?
Maybe I could just say something about if we look at some of the sort of more structural cases or policy cases. We tried in this book. We tried to find a way of estimating how many individuals would be affected by these different cases, and it's always difficult because you never know what would have happened without the judgment and without the litigation as such, because it's not only the judgment that is important. I mean, just the threat of litigation is often enough to get things to move. So, and we tried to do that. So in the treatment action campaign case on mother-to-child transmission, we were assessing the differences between the regimes that was in place and the regime as it was progressively rolled out. And we were estimating that if you look at the first 5 years, or sort of the remaining of the period that Mbeki was president, that's where maybe not too much would have happened, about 10,000 babies, or I forget the figure, I'll see it here, how many, about 10,000 babies and about 500,000 quality-adjusted life years, because that's the measure we used, were saved by that decision in those first years. Another case I also want to mention was that there were a lot of cases not going all the way to court, but being in the process regarding generic medications. And that radically lowered. I included a graph on HIV/AIDS at the end because I think it's quite interesting. In South Africa, actually in most places, the HIV/AIDS cases were first. But if you look at this graph, you can see that the number of cases in South Africa is just daunting compared to the rest. I mean, South Africa had more HIV-infected people than India, Brazil, Colombia, Argentina combined. So it's a huge, huge number. So when you look at the effect of lowering drug prices, the number of people who could be then treated for the same amount of money increased radically. You can read about that in the book. And you can have a soft copy of the book if you want to. And it will be in Spanish in next year.
Siri, thank you very much indeed. Thank you. Just to reiterate that point, Siri has very kindly provided her book in soft copy, which we will circulate amongst everybody. So many of those avenues of thought can be explored at your leisure after the event. Many thanks.